I'm Jwala. Today I'm using the Calgary Family Assessment Model to assess a family. I'm working with 15 years old Clarice who is having the diagnosis of brain cancer. So today I'll talk with her mother, Mrs. Mary, and I'll gather some information about the family and draw the echo map and genogram of the family, and then I'll find like what problem and resources the family will need to cope up in this situation. So let's talk with Mrs. Mary. Hi, Mrs. Mary. How are you today? Okay. Okay, so I'm a student nurse Jwala. So I work in the oncology unit of this hospital, and today I'm taking care of your daughter, Clarice. Today I'm here to talk with you regarding your family, your whole family, who is in your family, and then I'll do some echo map and genogram at the end of this interview. So is that okay if I ask some questions?
No problem.
Okay. So besides Clarice, who else live with you?
My husband, and he's 56-year-old,
Okay.
and my two sons, they're twins, and they're both 9 years old. And my mother, she's visiting me from Ottawa, and she's helping me out for now.
Okay, so she's 73 years old. Yes. Okay, and your sons are in which grade?
They're in grade 5.
Okay, so do you have any other extended family living nearby?
No, they are not nearby. My husband George's father, he's in nursing home, and my father, he is in Ottawa.
Okay, so your mother came here from Ottawa?
Yeah.
Okay, that's good. And let's talk about your job. Are you working right now?
Yes, I'm working full time as I'm a pharmacist. So my husband, he's entrepreneur, and he has long hours to work.
So how are you managing right now? The work?
Because my mother is here, so she's helping me out. And for meals and other stuff, my friend is coming to help me out for now.
Okay, that's good to have the support.
Yeah.
And do you require any financial assistance or anything?
Financially, I'm okay, but I need other support to look after Clarice's changing condition.
Okay. So any community resources you are using or your family is using right now?
We go to library and community health center, and we also go to church.
Okay. All right. So any other family members involving in some activities in the community or any resources they are utilizing?
No, I'm a member of Community Concern Toronto. That is a volunteer organization, and that helps homeless and new immigrants with housing and employment services. But due to Clarice's situation, I'm not able to go there.
Yeah, I understand that situation. So your sons, are they involved in anything?
Yes, they go to swimming lessons, and they also have soccer classes. And my daughter used to go ballerina classes.
Okay, it must be a really difficult time for you right now.
Yeah, it's all upside down. Sometimes I need to skip their swimming classes or soccer classes due to the situation.
So any like religious institution, you said church, right? You are going in the church, and so any spiritual practice you do?
Yeah, actually, I would like to talk to pastor about the present situation. Yeah.
So I'll talk. We have pastoral services here in the hospital, so I'll talk about that. Okay. And did any crisis situation happen to you before?
Yes, it happened when my brother, he passed away at the age of 70 with the brain cancer too.
Okay. And how did you cope at that time?
It's still taking toll on the family. It took me a long time to overcome that situation, and now Clarice is at the same point.
Okay, so yeah, so right now your mother is here to look after your sons, and then she's helping you.
Yeah, for
And-
now.
Yeah.
I'm
So
not
any
sure
okay.
what's going to happen in future.
So any other like family, friends, they are helping you?
Yeah, my friend, as I told you, and that she comes to help me with meals and some groceries and other chores. She can help me out with the situation.
Okay. So do Clarice, your sons, and your mother know about the diagnosis of Clarice?
No, they not at this point because I'm not sure how Clarice is going to take this diagnosis. And my mother, she's already in trauma about her son, and so for now I don't want to disclose anything to anybody.
So you were saying that your husband and you are having like conflict right now and not talking like properly. So do you want to talk about that, about the relationship with your husband?
Yeah, he's not talking because he's thinking that it's my fault because it's coming from my family side, because my brother passed away with the same situation, same disease, and so Clarice is affected with that now, and so he's blaming on me that I'm the cause of all this what is happening at present.
Okay, so by listening to your concerns, I think your family needs some support from the hospital. Like we have different team members here, and then they help in different aspects of the life and of the crisis a person is going through. So, like, do you want to join the teams and talk about all their family situations so we can do some interventions and support for your family?
Yeah, I would like to have a family care conference. I would like to involve my husband and Clarice in that, and because my sons are still too small to understand this kind of stuff, so I would like to involve them so that they know what is expected in future, and if we need to make any changes in our home or any other changes in our lifestyle, so we would like to do that.
Okay,
And
so yeah, there are like different members, like social worker, psychologists, like financial advisors. So I'll put your things with them, and then we'll decide what to do. Okay, so I think we need to arrange another meeting with your family, and we'll give you like what time to do that.
okay.
So do you have any other concerns you want to talk to me? With me
Not
today?
at present. We'll see how it goes.
Okay.
And so if any number is available for the services you're providing, I would like to have that information.
Okay, sure. Yeah, I'll do that. So after this conversation, I'll ask more detail about your family. So I'll construct the genogram and eco map about your family. So I'll know about the history of your family and then what resources you are using from the community. All those things I'll draw in a map. And is that okay?
Sure, no problem.
Okay. So nice to meet you.
Okay, me too. Thank you.
Thank you.